As Massachusetts is in the middle of the surge of COVID-19, recent data shows that minority communities are being hit particularly hard from this virus. State Representative Carlos Gonzalez of the 10th Hampden District spoke with me regarding the factors that are contributing to this and what can be done to protect these communities.
Well, many of our communities of color live in high-density neighborhoods where many health disparities, longstanding health disparities exist. And obviously, poverty is prevalent in many of those communities. Therefore, you're going to see the health disparities come out more so in communities of color. And we're seeing that as the data comes in as to who's being tested and who's coming out positive for the coronavirus.
Speaking of the data, have you seen a surge recently in these communities in Massachusetts?
I think the data clearly states that. When you look at what were limited data that's being collected, recently we challenged the governor and the state to start collecting this data like 4 weeks ago. So finally, they've determined that it was necessary to do so. You need data to make sure that you can strategize a better strategy to address it. So now you're seeing that low-income communities, communities of color, have a higher incidence of the COVID virus.
What do these communities need, the types of resources that these communities need to fight this virus?
Well, you need a short-term and a long-term strategy. You're going to need, obviously, testing right now. You need to have testing to make sure that you can determine who has the virus, who should be quarantined, and avoid the transfer of more folks to get the virus. So testing now, I think that we need a regional approach. You need testing to happen in community-based centers. We have clinics like in Springfield that have already a relationship with folks in the communities, and I think that would be ideal to have. We also need mobile testing. We need to go out to where our low-income housing units are, where a high population of seniors reside. You need to provide testing to essential workers who are working at our grocery stores, who are working in our healthcare industry, who are working at our nursing home. And when they clock out of their employment, they're coming back to the low-income communities, communities of color. So they are the essential workers, and I think that would be a great strategy to start addressing the issue, but also containing it.
And on top of increased testing, I know that the Black and Latino caucus is working on changing the standard of crisis care in hospitals. Can you elaborate on that? What does that mean? And why is this an issue that you want to see be addressed?
We've been addressing that for some time now, since April 8th, I believe it was. But just this morning, we received notification that the crisis standard of cares have been reviewed and changed to make sure that the health disparities and the conditions that were being considered that will provide points to individuals in case of a life and death situation, in case there's a shortage of ventilators available, that communities of colors, due to the health disparities and to the high incidence of heart disease, diabetes, and other permanent conditions, are not the ones that are considered when a decision has to be made on a life and death. So, again, the health disparities continue to exist in our communities, have been so due to systematic racism, and we need to make sure that at this moment, we cannot consider those health care outcomes as conditions to make a determination that somebody will not get a ventilator.
And what other ways is the Black and Latino caucus trying to help with this issue?
Well, we continue to look at the data as it comes in. We're seeing, like in the city of Springfield, you're seeing by zip code right now. It's only being released by zip code. When you look at those zip codes, they happen to be where many of our communities of color reside, particularly the Latino community, African American community, and they happen to be in my district. So we're extremely concerned about the data as it come out. We need more testing. We need to relook at strategy that may not necessarily at this moment require the resources to go to large-scale 1,000-bed hospitals like they're doing in central Massachusetts. And hopefully those resources come down to our community and can become strategically to community-based testing and mobile testing.
On a recent Connecting Point interview, City Council President Justin Hurst touched on the impact of this virus in the minority communities. And one of the strategies he suggested was having the individuals from code enforcement reach out to these communities in a different way to educate them. Do you believe that these are some changes that could be happening across the state in these communities?
One of the things that we encourage the mayor to do is to create a diverse COVID advisory task force with community members that already have a relationship with the community that they're reaching out to, have a linguistic and cultural sensitive message that's prepared, and an outreach effort by members of the community that have a relationship with the community you're trying to target, right? So I don't know. Maybe the code enforcement do or not. I would tend to want to recommend that we create a diversity task force because, again, this is on a short-term basis and a long-term basis. And usually when folks are coming to the community that don't have a relationship, you're going to have some folks consider whether they should listen to or not listen to. So hopefully a diverse community, diverse task force can be created in the city of Springfield and in other cities that can build on the relationship that already exists and deliver the message on the public health guidelines that the community needs to adhere to.
Are there resources available in different languages for these communities?
Well, we're getting as much information. We've requested again from the state. Now much more information is coming out in different languages, particularly on the resource side for our businesses, for our health care providers, for essential workers. And in the city of Springfield, you're seeing that we need to, again, create that diverse community task force to be able to develop the strategies that are linguistic and culturally sensitive to the communities we want to reach.
You mentioned businesses, and I know that there are many small businesses that exist within these communities in the state. What is being done to help those minority businesses still stay afloat?
Well, the stimulus package reached out to small businesses, right? And that was a good effort. However, many of the businesses that were left out are the businesses that are important to our communities of color, particularly. When you see the micro small businesses, the mom and pops, the essential small restaurants, the barbershops, the hairdressers, the gig economy, those businesses were really left out when you were under $200,000 in sales or less than 5 employees. So we're looking at a bill that we have submitted to the state where it's HD 485. And what we're asking is for a specific line item funding for micro businesses under $200,000 worth of sales and under 5 employees. Those are the mom and pops. Those are the at-home businesses that will not receive any funding with many of the programs that have been established from the federal side or the state side. I got to say that the city of Springfield did right off the bat launch a grant program that was effective in reaching some of our businesses, and I got to commend the mayor for that. And we hope that that fund can be replenished because those are the programs that really targeted the micro businesses, the small restaurants, the small mom and pops within our cities of Springfield and throughout.
What message do you have for the residents in these communities that may be worried they're essential workers, families rely on them? What would you tell them?
Well, again, government has a role to play from federal, state, and local. And as individuals, we do also. We need to adhere to the guidelines. We need to stay at home unless there's an essential need to go out. We need to wear face masks. We need to wash our hands. We need to check on our relatives and families and friends if we don't hear from them in a period of time. And we need to make sure that our seniors are protected. And one of the best ways to protect them is to stay away if you are sick in any way or there's not an essential need to be visiting people, because I think that's going to be extremely important as we start opening up our businesses, or we start opening up our economy. We need to still have certain guidelines in place.